Hello, Connecticut, and welcome to the Paid Leave Podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut paid leave and maybe just a little bit more. Connecticut paid leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave Podcast. Connecticut paid leave has been giving benefits since January to those who are adding to their family by pregnancy, adoption, or fostering. And both parents can get up to 12 weeks of income replacement to bond with their family. And women can take pregnancy leave before the baby is born as part of that 12 weeks. Joining me today to have a great conversation about all things Planned Parenthood is Amanda Skinner, the president and CEO of Planned Parenthood of Southern New England, a longtime supporter of Connecticut paid leave. And I just want to thank you so much for taking time out of your very busy schedule to join me on the podcast. I'm super honored and excited to have you here.
Well, thank you, Nancy. It's a pleasure to be here with you today. I love talking about all things Planned Parenthood, so I'm excited to have this conversation. We are so grateful for Connecticut Paid Family Leave and our partnership there.
You've been involved with Planned Parenthood for a while before you became president and CEO, and you practiced as a certified nurse midwife, which I love. Can you tell me about that journey?
I did. So when I was in college, I became very involved in what was then what we called the pro-choice movement, right? So the language has changed over time and shifted, but at the time, that was the language that we used. And I was president of my university's pro-choice organization. And when I was a senior in college, I was in college in Texas. When I was a senior in college, I drove from Texas with two friends to Washington, D.C. in the spring of my senior year to attend the March for Women's Lives, which was a reproductive rights march. And at the time, it was, I believe it was the largest march on Washington that had ever happened in terms of attendance. And while I was there, I heard Faye Waddleton speak, and she was then the president and CEO of Planned Parenthood Federation of America. And Faye Waddleton was also a certified nurse midwife by training. And I was trying to sort of figure out what was going to happen in my life next. I was senior in college. It was time to figure that out and make some decisions anyway. And I heard Faye Waddleton speak, and I thought, I think this is it. Like, I want to be Faye Waddleton when I grow up.
Oh, my goodness.
Someday I am going to work at Planned Parenthood. That became the plan. And I was very committed to advancing access to healthcare for women, women's ability to control their own bodies, lives, and futures. And again, also a shift over time. I just want to acknowledge that I'm using the language that was in my mind at the time. And of course, now we have, a lot of more mature understanding of gender. But again, at the time, that was sort of the framework in my mind. And also at that time, that was before laws were even passed that required that women be included in research, healthcare research or medical research, right? And that there was appropriate representation. So it was a really different time. So I thought, if I'm going to transform healthcare for women in the United States and I'm going to advance access to care and abortion care, I should probably become a healthcare provider first. And I decided, looked at my options. I went to a post-baccalaureate pre-med program thinking maybe I would go to med school, but I ultimately decided to become a certified nurse midwife. And there was a lot of thought given to that. And it was really rooted in the midwifery model of care and the midwifery framework of partnership between patients and providers, and autonomy in decision-making for patients, that the role of the provider was to partner with their patients, not to tell the patients what to do, but to really partner with them, to inform them, to provide information, and to work with patients to create the best possible plan for their own health and well-being, whether it was about their regular women's health or their pregnancy health and their pregnancy outcome. And so I was really attracted to that model as a nurse midwife. So I became a nurse midwife, and I practiced in Connecticut, in Waterbury, Connecticut for 10 years.
Wow. I also read that in college, you taped safe sex slogans to condoms and handed them out at the student center, which you would have been my friend. You know that, right?
I did do that. Now I know. And I'm so glad we would have been friends. I did do that. Actually, one of the pictures I have in my photo album from college is me sitting on this flowered couch that I fished out of the trash somewhere, taping safe sex slogans to condoms. We had dipped the condoms in red paint, not the condoms themselves, obviously, the condom packaging. And anyway, I did do that. And in fact, one of the other things that I had done that I have a really funny memory of is that we had set up, I and the vice president of the Rights for Choice group, which was the name of our pro-choice organization on campus, we had set up a cell phone in 1991 out in front of the library. So if you can imagine, the cell phone was like in a suitcase. It must have weighed like 50 pounds outside the library, so that people could call their legislators.
Wow.
And share with them how they felt about access to abortion and the Roe decision. So yeah, I have a lot of memories of things that we did then, and that really started my journey.
Yeah, your advocacy,
my commitment to advocacy and to healthcare.
How did all your experience clinically prepare you for the role now as head of Planned Parenthood of Southern New England?
It's funny. I don't know that people would make the natural connection, but to me, there actually really is a natural connection between being a midwife and being a CEO. So as a midwife, again, I saw my responsibility as, I had a certain expertise that I contributed to the relationship I had with my patients, and they had expertise because they had expertise about their bodies and what they wanted and their own lives, right? And we worked together to create the experience that they wanted to create. And I really did see my relationship with them as sort of a partnership, and that, my role was to sort of shepherd the experience for them and steward them and support them. And shepherding and stewarding and supporting, I mean, that's what a CEO does. And so the skill sets that I built, maybe the specifics of the knowledge are different, right? And I went to business school, and I had an entire career between being a midwife and becoming the CEO at Planned Parenthood. I had an entire career in healthcare administration and leadership as well. But the skills that you build as a midwife, the relationship skills and the ability to sort of lift up and see comprehensively things, the sort of dynamic of what it means to influence but not control, to partner, to shepherd things forward, to borrow language from our national president and CEO, Alexis McGill Johnson, to create the conditions for something to happen, but to empower and to be in relationship with people who are empowered to do the thing that they want to do. That's all very relevant to being a CEO every day, whether you're the CEO of a bank, honestly, or the CEO of Planned Parenthood. The other thing I think is that that mental framework, that midwifery model of care, to me, is very connected to the way we think about care at Planned Parenthood. The care we provide is very rooted in dignity for our patients, respect for our patients, respect for their own decision-making, their own control over their bodies and their healthcare decisions. And that framework extends across all of the care that we provide at Planned Parenthood. The other thing that I just wanted to really call out is that these bans always particularly harm people who are already marginalized by the healthcare delivery system the most. I am a, employed, insured, white woman in the United States. If abortion were banned in my community, I could get on a plane and fly somewhere. I have paid time off of work.
Yeah.
I have transportation. But these bans significantly harm and contribute to perpetuating cycles of harm for Black and Brown communities, immigrant communities, members of the LGBTQ community, people who live in poverty, people who may not have transportation or access to childcare, because most people who have abortions are people who already have children, people who may struggle to get time off of work, or may not be able to afford time off of work.
Right, they have part-time jobs,
Right, or are cobbling together multiple part-time jobs.
Yes.
So to place additional burden on those folks to be able to access the care they need, it's just unconscionable.
It is. And I know that there's been some maternity units at rural Connecticut hospitals that have closed over the years. And women now have to travel longer to get to any kind of health care for women like Sharon Hospital and other hospitals. There's been a lot that have closed. Why is that happening in our state? And how do we combat that?
Well, I think the reality is in the moment, most hospitals and health systems, though not all, are nonprofit organizations,
Right.
but we operate in a healthcare delivery system that, for example, ties health insurance to our employer, that ties whether or not we have paid family leave to our employers. That it operates in a broader system of capitalism, and market forces are going to drive things like access to healthcare. It is one of the things that makes me incredibly proud to be at Planned Parenthood. For example, we recognize deeply that being able to both physically or virtually access care is so crucial to our patients. We have a Planned Parenthood health center within 30 minutes of almost every person of reproductive age in Connecticut.
Fantastic.
Right. And the reason that we have that physical footprint, we have 14 health centers in the state of Connecticut, is because we know that physical access is really important to people, that being able to get to us for care is really important to people. We don't turn people away based on their ability to pay at Planned Parenthood. We are absolutely committed to living up to the promise that we make to our patients that we will provide care no matter what. And that care will be dignified and, respectful and high quality for our patients. Now, that means, of course, that we rely on support that extends beyond sort of the typical market system of healthcare. And that's something that differentiates us, right? Our donors, our supporters know that it's their contributions that make it possible for us to live up to that promise.
Yeah, and that's the interesting part, is that there are dedicated people who donate to Planned Parenthood. Have you noticed an uptick in that since the Roe v. Wade decision?
We have seen an uptick in support. We've seen that in a variety of ways, and I think that's also really important. We have seen our supporters come through for patients across the country, people who want to know how they can support people from other parts of the country who need to access care here. And there are great ways to do that. The most valuable ways that people can do that is they can support their local Planned Parenthood directly with financial support. We are the primary provider of abortion services in Connecticut. There are other independent abortion providers, and there are private practices and hospitals, but we are the primary provider of abortion services in Connecticut. And again, very committed to our promise to keep our doors open no matter what to people. I am very proud to be here in Connecticut, and very proud of the ways in which we have been able to, I think, be a model for other states in terms of expanding access to care, taking down barriers to care, really working to ensure that the various barriers that people face to being able to get the health care they need, whether it's abortion care or other care, that we are working feverishly in this state to make healthcare more accessible, whether that's expanding access to Medicaid or, ensuring no copay access to birth control or, again, having paid family leave.
Yeah.
These are critical steps that we have taken to advance the health and well-being of all of the people in Connecticut, including the work that we have done around expanding access to abortion. So I'm very, very proud of that.
Connecticut paid leave can help communities that need it the most with up to 12 weeks of income replacement. What were your thoughts when it finally passed as a law in 2019?
Obviously, we were thrilled. Paid leave is so important, and we were delighted that it passed. And of course, we were really proud to be part of that effort because, again, one of the things that I think is so important about Planned Parenthood and that makes me so proud to work at Planned Parenthood is that we recognize the whole lives that our patients live, and that our focus, our mission is and our vision is so that people can live their healthiest lives. And there are so many parts to that. And one of the parts of that is paid leave and paid parental leave. And we also, as a sexual and reproductive health and rights organization, another part of sexual and reproductive health and rights is maternal health and equity in maternal health. And a critical part of equity in maternal health is access to paid family leave. And again, as we know, because these things had been tied to employment and employers, people who might have worked for small employers or people who were cobbling together multiple part-time jobs, people who, again, probably have the lowest incomes and the least capacity to be able to take time off to be at home with their newborn child, suffered the most from not having access to paid leave. And that lack of investment, that lack of societal investment creates a less healthy society. So if what we want is a healthy, thriving Connecticut, then this is a critical part of a healthy, thriving Connecticut, a healthy, thriving economy, healthy, thriving families, healthy, thriving communities. And we also know that when we look at sort of where there are the most specific inequities in maternal health outcomes, it is Black women and Black birthing people who, experience the impacts of structural racism in the maternal health care system, but also structural racism sort of societally. That impact is erosive and perpetuating on people's ability to have a healthy pregnancy and to have a healthy postpartum period. So it is even more critical that they both have the time they need to recover and access to resources during that time so that they can attend to their own health and well-being and the health and well-being of their baby. So
it seems that Connecticut Paid Leave and PPSNE work well together to really take care of the marginalized communities. And I love the fact that 60% of men are using the bonding time, and that really does help women with postpartum depression when they have a partner who's active, raising these new infants or having them by adoption or fostering. It's a beautiful thing, because I think that was also very stigmatized for a very long time for men.
100%, 100%. I think, the next, not as it relates to paid family leave, but there are additional frontiers for us to address in pregnancy health outcomes, maternal health outcomes, family health outcomes around being more inclusive, around LGBTQ couples. So I just want to also say, yes to that, and yes to the partner, whether that partner, whether those partners are man, women, doesn't matter, non-binary people, transgender people, like whoever they are, that ability to partner home with somebody. I think there's really good research on this, actually, that mothers who take paid family leave are less likely to experience postpartum depression and less likely to report parenting stress. That people who have a supportive partner at home with them during the postpartum period are less likely to experience postpartum depression. Families are more economically secure if both partners or all partners have access to paid time off to be together as a family and to build their family. They are more secure as a family and more stable as a family to have that transition time together.
And the kids are happier. It's
and
really
I think
healthy.
that people have to, I think sometimes, maybe it's human nature, maybe it's societal nature, I'm not sure, but we often think sometimes very discreetly, concretely, and short term about costs associated with things. Well, this is going to cost something, as if we have not been costing ourselves something by not having a program like paid family leave.
Exactly.
There is a cost to not having paid family leave. There is an economic cost, there is a family cost, there is a health cost, there is a well-being cost, there is a social and community cost to not having paid family leave. Having paid family leave mitigates those various types of costs. And by cost, I'm not talking just about dollars, right? I'm talking about all of these, dollars, but also everything else. And if what we want is a thriving community, a healthy community, healthy people who are, have strong families and strong contributions to their community and society and to each other, this is actually really critical to creating the world we want to live in.
Yeah, it really is. And one of the things I love about Connecticut Paid Leave as well with caregivers, the terminology of family has expanded exponentially. And I just love that was written into the law. And I think very inclusive as Planned Parenthood of Southern New England is, I think the vernacular is changing, right? There's a shift. So everybody is much more accepting of families that don't look like traditional families. So I think
Right.
that's a beautiful thing. And I think that we're very symbiotic in working together with each
That's
other.
right.
And I think it's really wonderful.
That's right. Connecticut paid family leave made sure that, that the bill, the legislation that was passed was inclusive of all families, right? And that's what we want, again, to see is a world where all families, all people are treated with dignity and respect and have the sort of conditions around them to create their healthiest life. And again, we were really proud of the Connecticut paid leave effort and resulting legislation, and now the continued work of Connecticut paid family leave to make sure that that's the case for those families as it relates to paid family leave.
Well, there's a lack of healthcare workers across the country, and I know several area hospitals are using visiting nurses to make up the difference. COVID caused a huge amount of burnout. How has this clinician shortage impacted Planned Parenthood of Southern New England?
For several months, we were deeply, deeply understaffed across the agency, and it definitely had an impact both on the staff and our patients' ability to access care. But we again are working like feverishly every day to make sure that we are as fully staffed as we can possibly be, that our staff have the supports that they need to be able to do their jobs, because our staff care so deeply. I mean, that is the beautiful thing, is that they might be burnt out and tired, but they care so much about our patients. They care so much about the communities that we serve. Nobody works at Planned Parenthood who doesn't care deeply about the mission of the organization and the work that we do and the communities that we serve and why we are here. And sort of fundamentally, we exist to ensure that people have access to the care that they need so that they control their own bodies and that they can control their own lives and futures. And everybody who works here knows and understands and embraces that and are just so committed to sort of manifesting that in the way that they work. So yes, we have been impacted by it, and we have been doing everything that we can to support our teams and to try to address those healthcare worker shortages within our organization, recognizing that it is a systemic issue, and we are not immune to those systemic issues.
Well, I didn't realize all of the services that you have. I didn't know that vaccinations were part of it for HPV or hepatitis B. The flu. I didn't know that you guys did primary care or cancer screenings and gender affirming hormone therapies, telehealth and sex education. I mean, kind of new sex education and all of that. But I didn't know about all of that. And I didn't realize you would go in and teach about healthy relationships and what that looks like. And that's really important. I did a podcast on domestic violence, learning what is right and wrong and healthy relationships. That's so important.
It is. So there's so much I love about Planned Parenthood.
I didn't know about all these things.
Here's the thing I love about Planned Parenthood. Our mission actually has three parts. We are a healthcare provider, we are an advocacy organization, and we are an educator. And in my mind, I visualize those three parts as like interlocking gears that are necessary for each other. Because as an educator, what we do is we educate young people and engage young people and educate educators and work with parents so that people have the information that they need so that they can make the best decisions for themselves. As a healthcare provider, we provide the literal, actual access to care for people. And as an advocacy organization, we do upstream systems change work to create societal conditions that make it possible for people to be able to get to that care. And none of them work without each other. If there is an abortion provider in your community, but you can't get to it because you don't have any paid time off of work, or you don't have access to transportation, or you don't have insurance, it doesn't matter that the provider exists. So we need to do the systems change. If people have the right to abortion, or they have covered birth control without a copay, but they don't have good access to information, they don't have good knowledge themselves about how to navigate the healthcare system or how to make good choices for themselves about what birth control option is right for them, then it's less valuable to them that they have the right. But having a right is also meaningless if that right is not physically accessible to you. So it's necessary, if we're going to do the advocacy work, that we make it physically accessible to people by having actual healthcare provision, right? So all of these things are deeply tied to each other and highly dependent on each other.
How can people contact Planned Parenthood of Southern New England, whether it's for healthcare or to be a volunteer or to make a gift or donations, which
yes.
which you need?
All those things.
Yeah.
So there are a lot of ways to get in touch with us. The easiest way to get in touch with us is to go to our website, which is www.ppsne.org, or to follow us on social media at PPSNE. You can follow us on Instagram, Twitter, Facebook. Those are great ways to get information about all of the different ways to engage with us. I would love for people to come to us for healthcare. Our health centers are beautiful. They are modern. Our healthcare is of highest quality. Our patient experience is great. The care that we provide is truly patient-centered. And Planned Parenthood is for everybody. Anybody who needs sexual and reproductive health care, also people who need primary care. We provide comprehensive primary care services at several of our health centers and limited primary care services like flu vaccines or back-to-school exams at all of our health centers. So sometimes when people are wondering about how they can support Planned Parenthood, one of the best ways to support Planned Parenthood is to come to Planned Parenthood for your care. And you can make an appointment online. Or if you go to our website, our phone number is right there. For people who want to donate, you can go to ppsne.org/donate. Or you can just, write us a check and send it to us.
A blank one, preferably.
No. Don't send us blank checks. But truly, every gift matters to us deeply. Every gift makes a difference. Smaller gifts may offset the cost of somebody's birth control who can't afford it. Larger gifts might offset the cost of an abortion for somebody who has to pay cash for that because they're traveling from a state where they don't have insurance coverage for abortion. They have to pay out of pocket. Or it might pay for transportation for somebody. Or it might help ensure that we're able to provide care to a patient without having to concern ourselves with whether or not that individual in front of us can afford it. Or it enables the advocacy work that we do. And it's so important that people understand that the healthcare work we do and the advocacy work we do and the education work we do are dependent on each other. We cannot do the healthcare without creating systems and structures and knowledge and information for people to be able to leverage that healthcare to the best of their ability for their own health. And so, every gift matters. I hope people, one way that people might think about supporting us is, tell your abortion story and tag us, and say, here's my abortion story, and I'm going to share my story without shame or stigma. So if you share it on social media, tag us in your sharing of your story, or just share your story, or even just tell it privately to somebody you've never told it to, but who you love and who you want to know you more deeply as a person. But that storytelling is just really, truly critical component to being able to advance a movement for true reproductive rights and freedom for all people.
Love the fact that you are available to everybody. And I want to thank you for that. And thank you for being such a thoughtful CEO. Amanda Skinner, President and CEO of Planned Parenthood of Southern New England. Thank you so much for your time today.
Thank you so much. It was a pleasure to be.
Yeah, you just had so much great information. And thanks again for being on the podcast. For more information on Planned Parenthood, go to ppsne.org or on social media at ppsne. And for more information or to apply for benefits, go to ctpaidleave.org. This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.